Welcome to the podcast. Today, we are diving into a specialized area of pelvic health that often feels like the final frontier for many clinicians, colorectal health. Joining us is a pelvic health expert to discuss the Essential Pelvic Health Colorectal Manual Assessment and Treatment Techniques course, often referred to as CREMAT. This is a continuing education course that I created, and we're going to talk about how it's changing the game for practitioners. Jessica Hammond is going to be the CREMAT instructor for the lab portion of the upcoming CREMAT lab October 10th in Pittsburgh. And Jessica, you took PREMAT, the pelvic rehab course in 2021. Then later that year, you took the colorectal course and you've TA'd for the colorectal course. You've been an avid mentor creative member, as well as a clinical contributor. And now you're going to be the lead instructor. Welcome. And please tell us a little bit about where you are, where you're working, and how you're supporting colorectal, GI, and bowel health for your community.
Sure. Thanks for that introduction, Laura. I'm Jessica Hammond. I'm a pelvic health occupational therapist. I've been an occupational therapist for over 20 years, and I've been working in pelvic floor therapy for well over seven. I work at a hospital. I do outpatient therapy. I have a full caseload of pelvic floor therapy. I see patients 5 days a week. When I first started out, I was kind of thrown into it with having to do a lot of colorectal assessments, and this course just fit perfectly in for me to help hone my skills. So I'm so thankful that Laura created this course because it's really helped me a lot.
Yeah, when I created Premat, I had a lot of follow-up questions like, when are you going to put together a colorectal course? And I was like, well, let's do it. And it worked out great. And your questions in the Mentor Creative, like for that ongoing support, were definitely leading you in the direction of needing more information because you can certainly get started without these advanced techniques, but you kind of found out pretty quickly that you needed them to supplement, especially the specific referrals that you were getting.
Oh yeah, it was definitely intense for a while, but I was so thankful you created that course.
Awesome. And then, so to start us off, there are many colorectal courses out there. What have you taken in the past? And more importantly, what stands out about CREMAT compared to the rest?
Yeah, so obviously I've explored a lot of different courses, certifications, and CREMAT was really unique because it didn't just look at the anatomy just in isolation. It was integrating the whole system. Whereas other courses might focus on just like the local mechanics, the CREMAT really provides that holistic lens, and it really bridges the gap between the theory and that advanced clinical application that I really needed with the folks I was seeing because they were not just basic constipation. They were folks that had had major colorectal cancer or surgeries or ostomies and reversals. So I really needed that understanding. But it's definitely helped me with some of the other patients I'm seeing too, like the postpartum population, the folks that are really eager to get back to running, or even just the urinary incontinence folks. So it seems like everybody has some sort of colorectal thing going on, and having this course is just key for sure.
Yeah, and that's I'm glad you brought that up because just the colorectal course doesn't just treat colorectal symptoms, and a lot of times our clients aren't coming to us for the colorectal symptoms, but they are secondary, and it's if we can treat that, then the other symptoms like bladder incontinence or painful intercourse can be cleaned up, or sometimes doing intravaginal treatments and interventions for someone with vulvodynia or painful intercourse, they can't tolerate that. So you can do the intrarectal and then you can actually interact with the structures without irritating and inflaming things.
Exactly. Yeah, that was one of the biggest takeaways I got too, is just a better understanding of that and that diversity, that ability to affect the muscles in a different way.
Yeah, different perspective.
Yeah, perspective.
Uh, okay, so that sounds comprehensive. Could you walk us through specifically what is covered in the curriculum? right? So,
Sure.
and I can help you too, because I can.
Yeah, yeah. I remember really liking the interrectal work, obviously, and being able to try different positions. You weren't just lying on your back or lying on your belly. We were able to get up and move and try different positioning or different positioning of the patient. I really liked the ability to work on some fascial mobilization techniques as well as working on the visceral fascia and that visceral piece. One of the most important things I really found, and I think a lot of your mentoring help with this, is the posterior chain assessment. Just being able to understand how restriction that whole posterior chain can really impact somebody's mobility and ability to lengthen and let those muscles go if there's a lot of tension in that posterior chain.
Yeah.
And then a really, really amazing, sorry to interrupt, was the interrectal balloon training. I've used that a bunch of times in my treatment, and it really helps with some of my more advanced colorectal condition patients.
Yes, and that's a contribution from you directly. And even with Pramat, the pelvic rehab, the intro course, when I created both of these, it was what did I wish I had in the coursework when I started out, right? So, there's a lot of influences. I took my initial training with Herman and Wallace. I have almost 20 plus years of pelvic, like experience that I'm bringing to this. And especially with intellectual work, like you said, we get taught a certain way in a certain position, but like let's make it dynamic. Let's move, let's breathe with it. Let's start to really explore and get curious with the interventions outside of the traditional standard approach. So, and Ramona Horton, going back to that, the fascial mobilization of the viscera. So that was a big piece I really wanted to incorporate because after I had taken my colorectal training, that's where I was really driven to. I was like, well, I learned at the exit point, the end point, but that whole GI system is from the mouth to the anus, right? Not to be too graphic, but there's a lot, especially through the abdomen, through that whole pathway. So how can we interact with that? Because, we know with like fascial restrictions. It pulls everywhere, not just right where that scar tissue or that restriction is. So we have to look north, south, east, west, anterior, posterior, all over the place to be able to see where we can free things up and, look at the nerves, the vascular supply, all the things. So
Mm-hmm. Yeah, it's amazing.
and we're starting to kind of add some bonus materials too, like that nervous system regulation, right? So, what can we
Yeah.
do to help people really tune into what are their physiological responses? Like if they have dyssynergia, if their pelvic floor is not coordinated, or if they have tension that they're not able to connect to, well, why? What is going on with the nervous system? How can we create an environment and a sense of safety to be able to start to make a shift and make a change for them? And then some bonus techniques for like external anal sphincters, internal anal sphincters, and fissures and fistulas. So those end up being kind of scary, right? But they don't have
Yeah, for
to be. So,
sure.
yeah. And then for clinicians listening, when did you feel you were ready for this next step? What kinds of clients were you seeing that made you realize you needed this colorectal training? We kind of touched on that a little bit, but
Yeah, we touched on that, but I definitely think that this can apply across the board. So my caseload was strongly colorectal, being referred from colorectal surgeons, but I can see how it impacts all the different diagnoses that I see on a regular day because while I still get referrals from colorectal surgery, I also get referrals from the OBGYNs and the urology groups and the oncology groups. So we're seeing this kind of across the board as something that's really important. And I identified right away that I needed like a CREMAT course um, just to really help me. And it's been invaluable.
awesome. Awesome. And what do you wish referring medical professionals and clients knew about the scope of this work, like all that we can do?
Yeah, especially medical professionals and clients too. I think it's important that they understand the whole system and how it kind of all works together and that it's not little independent silos working separately from each other, that all the systems affect each other. I know that a lot of times with specialty groups like colorectal surgery and urology, they don't necessarily see the impact of the other systems on their system. But as a pelvic floor therapist, we're able to kind of take that holistic look at all the systems and how they work together. And having an understanding of the colorectal system is really important.
Yeah, I agree. And, we were actually talking about this the other day is because I have a client who's really trying to almost like pass the test to have a surgery. So they have
Yeah.
a fissure, they have a fistula that's not healing, so they want to do this test, but the colorectal surgeon says your pelvic floor muscle like squeeze is not strong enough. And so the message to the client is I need to strengthen, I need to do Kegels, I need to strengthen my pelvic floor so I can have the surgery because the surgeon is afraid that they will be incontinent afterwards. And so
Yeah.
being able to get to understand that the surgeons may not quite understand the anatomy in the perspective that we do, and being able to have those conversations with them because really this client has like increased pelvic floor tension, which is restricting the structures, which is preventing healing. So really what we want to do is promote some expansion, some lengthening, some blood flow. And a lot of times that will bring back the strength, right? If their muscles are tight and you go to squeeze it, nothing's going to happen, right? So
Right.
being able to, we understand that as pelvic health therapists, but being able to have those conversations and help educate them and educate the client to self-advocate as well. So I think I'm even going to go with the client to the next appointment to be able to have this conversation with the professional. And so, I mean, I would love to see more of these professionals taking Cramat too.
Yeah, I would love that as well.
Yeah. So for Pramat, we've had, OB nurse practitioners, we've had midwives, and there's such a great, like, it's such a great
Yeah.
dynamic of learning and like knowledge sharing in that environment. And to be
Yeah.
able to, to be able to, like, for them to understand how we are actually intervening and implementing strategies to help improve their client's symptoms. So, and then they just make better referrals. They're like, oh, this person, like
Yeah.
they start to identify, they start to see. Once you see it, you can't unsee it, right?
Yeah, I love that.
If you had to pick like one, what is the number one tool or concept you gained from Cramat that you use on a daily basis?
Oh, that's somewhat tricky because I feel like I use a lot of them. One of my most used tools, I guess, comes from an understanding of the nervous system impact on the colorectal system and the GI system. But in addition to that, I feel like the manual techniques obviously are important. Ability to assess coordination, relaxation, um, utilizing techniques to help move the bowels better. Because I feel like almost everybody has some degree of constipation, right? So it's like I think Michelle Lyons said, "Assume constipated until proven otherwise." Right? I believe that was her. So I feel like everybody's got some degree of colorectal stuff going on. So that was that was a big piece of it, just that nervous
Yeah.
system understanding, but the functional like muscle assessment. But I really liked oh, let's add another one, right? Because you said just one. How about the visceral mobilization techniques? Because prior to taking your course, I really didn't understand that piece of it. But once I got to try some of the techniques on the participants and really see how they worked, I started utilizing them more in my sessions and really found that that was a missing link that really helped people get better faster.
Awesome. Great.
Yeah,
And yeah, you mentioned Michelle Lyons. She's a big influence on me. And I'm happy to share the constipation video series that I share with all my clients. It's got 4 videos and it kind of breaks down routine, how bowels are habitual, how you can build a routine and support, stimulating the brain and all those things. Posture and alignment for muscle tension, gravity, those sorts of things. breathing, how to be able to create, openness, like open the door, and
Yeah.
safe pressure through the open door rather than straining through
Yeah.
the closed door. And then some muscle energy techniques that I came up with that
Oh, I
I
love
find really
that.
helpful when you are constipated. How
For
do you
sure.
avoid, kind of like straining? And then all that is like wear and tear on our connective tissue. And then we might be, putting ourselves at risk for prolapse and pain and fissures and all those other kinds of things. So I'm
Yeah, I definitely love that stuff too. I give that
happy to
stuff out
share
every
that.
day.
Yeah, I'll put that resource in the notes so people can access
Hmm.
that. And then for the fascial mobilization of the viscera, those came from Ramona Horn. She's the guru for that. And she allowed me, she approved that I could include those techniques in Cramat. And then if you really gravitate towards that, I highly recommend you go on and take her courses. So we get a little bit of little taste of everything in it.
Love that.
Yeah. And I love, you got to understand the mechanisms to understand the intervention. So the more you can understand, and it goes, a lot further beyond the anal canal and the rectal, system for that
Hmm.
interrectal, but the whole GI system and really looking up all through the abdominal space, even into the esophagus, and where it starts with chewing, right? And the motility and then the outlet. Um, so I think we kind of covered all the questions because the last question was what stands out from other coursework. Um, do you
Yeah, and
there?
I just feel like the deeper dive into the whole GI anatomy and its integration into, or the nervous system integration into the GI system, as well as like the understanding of the postural and the posterior chain type stuff, as well as just like, just a deeper understanding of the holistic system of and how the GI impacts it.
Yeah, and that, just because it's manual techniques doesn't mean we're just doing manual. It's mind body
Right.
manual. It's being able to integrate that and kind of, be able to listen and shift things and bring that whole person, whole system, multi-system approach to pelvic health. Okay. And so if you blend, yeah, so we blended like some Hermann Wallace principles, 20 years of experience. We've got nuggets from Ramona Horton. And for those who are ready to sign up, there are many options to register. So I know it can get confusing. So I like to just spell it out. So there is the whole online course that is 8 CEUs or zero point 0.8 CEUs, 8 hours of continuing education. And these are self-paced modules, but that is the prerequisite for the lab add-on. So you can just take the online self-paced, um, and then you can later add on a lab if you want to, which is coming up in Pittsburgh with Jessica, and I'm going to join her too. So you get both of us.
Yay!
Yep.
So excited.
And that's October 10th. And so we'll get you the information for that. Or you can just sign up for the whole thing. You can get the full combo with the online component, and you'll have that to access and to be able to go back to as much as you need to as a resource, along with the live lab. And you get an early bird discount. So the early bird discount is $150 off. And you get the free constipation toolkit, which is another additional 6 continuing education hours. Um, However, so we had it set up to end August 1st, but we didn't get to do this interview until today, so I'm going to extend it another week. So we've got till August 8th for that early bird on the full combo. But it's all pretty reasonable. So if you wanted to do the online and that's what you have space for, and then next year you can add on the lab too, that's fine too. Um, Jessica, thank you for being here, and thank you for always supporting the mentees and your clients, just the whole community. And do you have any parting words that you'd like to share with the audience?
I'm just so thankful for Laura, really, but Laura and the Mentor Creative and the Essential Public Health team. But I want to say that having having the ability to assess the colorectal system is something that every therapist should really understand and be able to do, because sometimes you're just missing, half of the whole system, or if not more. And having a better understanding is really important. And if you do take the class, start using your skills right away. Don't wait. That
Yes.
would be my best advice. But
Uh,
I'd love to have you here in Pittsburgh. We have a great setting here. We're going to be at the Menopause Wellness Center. We have a lovely space, and we're real close to the airport and right off 79, so it's real easy to find and to get on and off the highway. So we'd love to have you. Thank you.
Incredible, incredible. And also, don't forget to look for us at the upcoming AOTA. We have an occupation-based pelvic health community practice, and we're going to do an open house. So you don't have to be an AOTA member or a member of the pelvic
Ooh,
health community yet, but we would love to have you. And Jessica and I are going to present on colorectal health. We also, for a collaborative approach between OT and PT for pelvic health, we're going to also have guest speakers, Lynn Schulte, as well as Susan Clinton, to be able to speak with us. And we have Lynn, Susan, and I have been approved to present at the APTA conference that's coming up in February 2027 on obstetric colorectal. So that's
wow.
exciting. So they will
Yeah.
share some like pearls of wisdom with us at with AOTA. So I'd love to see you guys join us there too.
Yay.
Yeah. Awesome. Thank you.
Well, great. Thank you.